Hi friends, good evening and welcome to my channel Mokambika Nursing. Friends, in this video, today we are seeing some important questions from cardiovascular system. We will see the question one by one. First question, a client admitted to the hospital with chest pain and history of type 2 diabetes mellitus is scheduled for cardiac catheterization. Which of the following medication would need to be withheld for 48 hours before and after the procedure? Our options are option A regular insulin, option B glipizide, option C repaglinide, option D metformin or glucophage. So our question is, a patient is scheduled for cardiac catheterization. Already the patient is having type 2 diabetes mellitus and the patient is on treatment of DM, and now the patient is scheduled for cardiac catheterization, and for that procedure which medicine should be withheld for 48 hours before and after the procedure, that we have to know. Among this medication, one medicine should be withheld for the patient. We will see which medicine. So here regular insulin, glipizide, repaglinide and metformin are our option. Among this, we will withhold metformin for the patient. So metformin need to be withheld 48 hours before and after cardiac catheterization. Why? Because of the injection of contrast medium during the procedure. So during cardiac catheterization, contrast dye is injected for the patient. So if the contrast medium affect the kidney function, with metformin in the system, the client would be increase the risk of lactic acidosis. So this metformin and this contact medium will affect together, and it will cause what it will affect lactic acidosis. It will cause lactic acidosis for the patient. So once the patient develop this acidosis, patient again will go for some complications. Complications means patient will show some signs and symptoms like nausea, vomiting, fatigue and deep breathing, muscle cramp. So in order to prevent that, we should withhold metformin 48 hours before and after the procedure. So our answer is option D, metformin. Next question, second question. A client is diagnosed with an acute myocardial infarction and is receiving tissue plasminogen activator, that is alteplase. Which of the following is a priority nursing intervention? So a MI patient is receiving tissue plasminogen activator. What is the action of tissue plasminogen activator? We have to keep in mind. Then only we can answer this question. So our options are monitor for renal failure, second option monitor for psychosocial status, third option monitor for signs of bleeding, and fourth option have heparin sodium available. So this is our question. A patient with MI is receiving tissue plasminogen activator. So what is the priority nursing intervention? That is our question. So tissue plasminogen activator is a thrombolytic agent. So while giving thrombolytic agent, as a nurse, what we should monitor for the patient? Then we can answer this question. So while giving thrombolytic agent, we have to note patient can develop hemorrhage. So hemorrhage is a complication of any type of thrombolytic medication. The client is monitored for bleeding. So the first priority is option C, monitor for signs of bleeding. That is our answer over here. Monitor for signs of bleeding. And the other options like monitor for renal failure, monitor for psychosocial status, that also important. Renal failure we can monitor by urine output checking and also psychosocial status, that all are important, but the priority intervention is monitor for signs of bleeding and also have heparin sodium available. Heparin sodium when we are giving after, if the patient is having bleeding, then only we can give heparin sodium. Before that, as a nurse, the priority nursing intervention is a monitor for signs of bleeding. Option C is correct. Next question, third question. Intravenous heparin therapy is prescribed for a client. While implementing this prescription, a nurse ensures that which of the following medications is available on the nursing unit. This is our question. Options are protamine sulfate, option B potassium chloride, option C aminocarbonic acid, and option D vitamin K. So, a patient is receiving heparin therapy. So, as a nurse, which medication should be keep ready for the unit? That is our question. Okay. So, the antidote of heparin is, what is the antidote of heparin? It is a protamine sulfate. So if the patient is taking heparin therapy, the medication protamine sulfate is ready for the unit. It should be readily available for the use if excessive bleeding or hemorrhage should occur. So while receiving the patient, there is a chance of hemorrhage. So the nurse should ready to keep protamine sulfate. Option A is the correct answer over here. And the other option, potassium chloride, aminocarbonic acid, and vitamin K is there. Potassium chloride is usually giving in the time of potassium deficit. And aminocarbonic acid, it is an antidote of thrombolytic therapy. And vitamin K is an antidote of warfarin sodium. So here our question is intravenous heparin therapy. So for antidote of heparin therapy is protamine sulfate. Option A is the correct answer. So all antidotes are important directly or indirectly it can come. So antidote for each medicines you have to read once. Next question, fourth question. A client is admitted with pulmonary embolism and is to be treated with streptokinase. A nurse would report which of the following assessment to the physician before initiating this therapy. Our options are adventitious birth sound. Second option, temperature of 99.4 degree Fahrenheit orally. And third option, blood pressure of 198 by 110 mmHg. And fourth option, respiratory rate of 28 beats per minute. This is our question here. Patient is diagnosed with pulmonary embolism and advised streptokinase for the patient. So, as a nurse, before initiating streptokinase therapy to the patient, among the following assessment, which one she should report to the physician? That is our question. So here, what is pulmonary embolism means? Pulmonary embolism is a condition in which blood clot or thrombus is lodged in the artery of the lungs and block the blood flow. That is called a pulmonary embolism. So here, blood clot is there. So streptokinase is an thrombolytic therapy. It is a thrombolytic agent. So thrombolytic therapy is contraindicated in case of severe uncontrolled hypertension. Why? Because of the risk of cerebral hemorrhage. So as a nurse, she should check the blood pressure, and if it is high, she should report to the physician before initiating the therapy. So our option C, blood pressure of 198 by 110 mm of Hg is correct answer. Normal blood pressure is 120 by 70 110 or 120 by 80 is the correct normal blood pressure. So she should check the blood pressure. If it is high, that she should report to the physician. So option C is correct answer. Next question, fifth question. A nurse is monitoring a client who is taking digoxin for adverse effect. Which finding is the characteristics of digoxin toxicity? Our options are tremors, irritability, option C, diarrhea and blurred vision. Option D, all of this. This is our question. So, a nurse is monitoring a client with the digoxin. Patient is taking digoxin. So, which finding is the characteristics of digoxin toxicity? So, what are the complications of digoxin, signs and symptoms of digoxin toxicity? As a nurse, we should know the signs and symptoms of digoxin toxicity. Then only we can answer this question. So, digoxin is an example of cardiac glycoside. Okay, the risk of toxicity can occur with the use of digoxin. Toxicity can lead to life-threatening conditions. So, as a nurse, we should monitor closely for the signs of toxicity. The early signs of toxicity include gastrointestinal manifestations such as anorexia, nausea, vomiting, and diarrhea. So, gastrointestinal manifestation of digoxin toxicity include anorexia, nausea, vomiting, and diarrhea. And subsequent manifestations include headache, blood division, visual disturbance such as diplopia, yellow green halos, photophobia, drowsiness, fatigue, and weakness, and also cardiac rhythm abnormalities. And the nurse should monitor these signs and symptoms closely for the patient. Here, gastrointestinal manifestation diarrhea is there, and also blood vision is also there. So our option C is correct over here. So all signs and symptoms we have to know, then only we can answer this question. And also as a nurse, she should monitor therapeutic level of digoxin range also. The normal range is 0.5 to 2 nanogram per milliliter. That also she should check. Okay, so here option C is correct, diarrhea and blood vision.